Okay, so this is suicide after receiving care. This will be by Andres, Ivani, Crystal, Simone, Leia, and Irish.
Nursing assessment, depression, and suicide. Suicide is a preventable and growing public health risk, and nurses are in a prime position to provide the assessments and follow-up care. The nurse's role in suicide prevention includes assessment, safety plan creation, and continually monitoring. Understanding our event and topic. This unfortunate situation could have been prevented if the support was available for this patient from start to finish. Ms. Papiston was not properly cared for and supported by the hospital staff. She wasn't given proper support for dealing with the loss of her child. Most importantly, there was no follow-up to ensure all her needs were met, and result was ultimately took her own life.
Primary causes of suicide and error. So this will be mental illness. Some subcategories will be depression and anxiety, traumatic experience, which is a loss of a family member, or physical or sexual abuse, also drug addiction or substance abuse. Losing a child during birth is profoundly a traumatic experience that can leave a long-lasting emotional, physiological, and physical effects on a parent or parents. Parents who experience the death of a child are significantly at a higher risk of suicide compared to the general population. And research suggests that up to 50% of parents who experience a stillbirth or neonatal death develop symptoms of depression. 90% of parents who commit suicide 90% of parents who commit suicide suffer from untreated depression. Stillbirth affects about 175 births, and each year, about 21,000 babies are born stillborn in the United States. The risk of completed suicide was higher in women who experience a stillbirth, which is at 95% compared to the normal healthy birth.
Solutions to prevent similar incidents from happening again. Number 1, peer support groups, family support, coping strategies, hospital and counseling centers, church groups, hospital staff education, risk assessment, follow-up care, example therapy and counseling, and crisis intervention.
Okay, 3 questions. What are the warning signs of suicidal behaviors? 1, verbal indicators. Example, talking about wanting to die. Number 2, behavioral changes. Example, withdrawing from friends, family, or social activities. 3rd, mood changes, expressing feelings of intense sadness, hopelessness, or emotional pain. The second question, ways you can help others cope with stress or depression. First one, listen actively and without judgment. Just offer a listening ear without interrupting or offering immediate solutions. Second, encourage professional help. Example, remind them that seeking help is a sign of strength, not weakness. Third one, offer practical support. Example, help with daily tasks or responsibilities if they're feeling overwhelmed. Example, cooking a meal or running errands. The third question, what is self-care after someone commits suicide? First one, seek support. Example, talk to someone. You don't have to go through this alone. Number 2, allow yourself to grieve. Take time to grieve. Permit yourself to process the loss at your own pace. Third one, engage in activities you enjoy. Just explore other countries, watch a movie, or make time for activities that bring you peace.
Suicide rate. According to research, It is estimated that up to 20% of maternal deaths are due to suicide, making maternal suicide deaths more common than deaths caused by postpartum hemorrhage or hypertensive disorders. Maternal mental health conditions are defined by the CDC as suicide, overdose, or poisoning related to substance use disorder, and other deaths determined by the MMRC to be related to a mental health condition. Maternal mental health conditions account for almost 23% of pregnancy-related deaths, and 80% of pregnancy-related deaths are determined to be preventable. The CDC has determined using the data from 36 state MMRCs that mental health conditions are a leading underlying cause of pregnancy-related death.
Joe Nathan's story. Joe Nathan had many different issues that had occurred in his life. Being abandoned by his father at an early age caused him to have emotional distress that was never resolved. As Joe Nathan aged into his young adult stage, Joe Nathan developed bipolar disorder and started to exhibit suicidal behaviors as cutting himself and making statements about death. He started to hear voices that he tried to ignore. These voices became too much and he started to listen to them. He began physically assaulting his family and killing animals. His family 5150'd him into psych wards. Due to his family's inabilities to afford treatment, nothing was helping. One day when his father came home, his father reported seeing something hanging from the tree in their backyard. He thought to himself, what is Joe Nathan up to now? Seeing abnormal things around the house was common, to say the least. As his father got closer to the sliding door leading to the backyard, he realized that Joe Nathan was that something hanging from the tree. He immediately ran to the tree and noticed that his body was lifeless. Joe Nathan was 19 years old.
So our